Hi, I'm Michelle Barone.
And I'm Mark Malone.
And it's time to wake up with Rhinebeck Bank.
Beautiful Monday it is today, Michelle.
It is. It's, you know what? It's always a beautiful Monday when you're waking up with Rhinebeck Bank.
I agree 100%. And, you know, our guest today is actually a local dentist, been in the area for a long time. I'm a little concerned, though.
Why?
So I want to make sure that he doesn't tell me that what I've been doing for so long is incorrect with my teeth. I'm always flossing, I'm always brushing.
Well, then you're doing the right things, definitely. I mean, I'd choose the water pick over flossing. I mean, I'd still do floss, but the water pick works well.
That's fancy, Michelle. So you have a water pick at home.
Yeah, and you just, it gets all that garbage out of there that you just don't want in there. And you don't even know is there.
Wow.
Yeah.
I need to learn more about this water pick. So who do we have with us today? Here, it's your dentist.
Yes, my dentist, Dr. Rich Whalen. Please come on out. Thank you so much for coming.
Thank you for having me.
Thank you so much for joining us. Please have a seat.
Please.
So keeping their teeth healthy, it's something that's you know, on a lot of people's minds. You know, what are some tips that you have for our listeners out there?
The basics, it starts with obviously nutrition, number one. If we could do all these other things, if you're not taking care of your teeth that way, you can be brushing and flossing, but if all day long you're eating garbage, you're drinking sodas or carbonated beverages, what people don't realize, things like Gatorade as well, things like that kids are having all day, you're bathing your teeth in an acidic or a sugary environment the whole day long. So you could brush and floss and all those other things, but if 10 hours a day your teeth are soaked in that, it's not going to be good.
And that affects the enamel, right?
Correct.
That could be your problem, Mark.
All I drink is water and coffee with no sugar. So the coffee probably doesn't help the color of my teeth, but certainly it's not the acid.
Yeah, water's the best. If you can just stick with water most of the day. At a meal, it's okay to have something else, because then the water afterwards is going to also help neutralize it, buffer it, and wash it down. So, so that's starting with that is where we got to get things going. Then after that is proper brushing, flossing. The water flosser, as Michelle's talking about, there's different brands. And Waterpick is a brand, Viajet is a brand. Phenomenal what it does. And as she said, when you get in, you clean it, more stuff is coming out than you.
So how is that hooked up to a water supply, or is there a tank? How does that work?
Yeah, small little tank. You can put just water in it. You can put
mouthwash I use.
Oh, really?
You can use a mouthwash.
You feel amazing after.
Wow.
Correct. Peroxide mixed in with the water, whatever you want. You just alter the setting, and away you go.
So how often do you recommend that you know, patients seek see the dentist essentially?
Very individual. Some people we see every 3 months for cleanings. Some need to even be seen more frequently than that. Twice a year is sort of the standard for people, where we try to get them in and really stay on top of things that way. But we do have many patients that are periodontally involved. They build up plaque and tartar or are more cavity prone, and we want to see them more frequently to maintain them.
Yeah, and talking about cavities, I know that there was a time where I had a toothache, came in, and you say, you know, it's not really a cavity. And that's what I liked about coming to you. I feel like I've been to other dentists where they've said, oh, you have a cavity here, a cavity there, 3 cavities, and all of a sudden you're paying thousands of dollars. But in essence, I like the way you explain to the patient exactly what's going on with your teeth and why. And being pregnant, there's some other things that go along with dentistry as well.
Yes, communication is the key.
Yes.
Also, what you asked before about how frequency, pregnant patients, during the hormonal changes that happen, the gums get more inflamed. So when kids are in braces or people are pregnant, oftentimes we want to see them more frequently than on a regular twice-a-year type setup.
Do you have a lot of kids as patients?
We do. We do. Families. We treat families. Yeah, it's great.
That's fantastic.
And what's a great time for a young child to start going to see the dentist?
Usually we want them in the chair having their first cleanings by the time they're 3 years old. But what we try to do is have them come in with mom or dad or an older sibling. From the time they can even just breathe, they're there. We put them in the car seat. Every one of our operatories, we have televisions in the corners. So we'll put on a cartoon for them in there. They can just sit, watch the cartoon. Maybe you get them on mom or dad's lap or in the chair at the end just to count their teeth. But get them used to it so they know who I am.
That's a really great idea.
And at the end, they get something from the treasure chest. As long as they're old enough, then we're not worried about them, you know, swallowing it.
Now, is Michelle still taking from the treasure chest, or?
Always. And she gets a sticker on her chart.
I do. My chart sticker. I'm a frequent dental patient. I'm going to bring Luca with me next time.
Yeah, it was great. Let them get seen, get used to it. Even when they're real young, we tell the parents, the ladies in my office are always happy to kind of keep an eye on infants or carry them around. They just, you know, get their motherly fix that way with the young kids. So yeah.
That's really cool. What about some different procedures that you do, like Botox? I hear that's a hot topic in dentistry now.
Yeah, Botox and Juvederm we can do as well.
Oh, wow.
I'm certified in both. We do it in dentistry. We're allowed to do it for TMJ issues for the Botox, and the Juvederm to areas around the perioral areas to kind of clean up the smile, make the lips look.
So it's cosmetic still, right?
It's cosmetic. The Juvederm is going to be cosmetic. The Botox is therapeutic because it's being used for TMJ. So we're trying to deaden the muscles of the masseter and the temporalis.
Interesting. I may know someone that needs that. And tell us about some challenging patients you've had in the past. Any very interesting situations that you've been faced with, or?
Yeah, you get the most challenging ones are the phobic ones that are really afraid to come in the chair. That we've had one lady just sobbing in tears before we even were able to do anything for her, not even touch her. And unfortunately, people like that kind of disappear and don't come back for long periods of time. But what we're able to do now is we do conscious sedation. What I do is conscious sedation in our office. So, and you can do just a regular level of sedation as well, like a Valium or Halcyon you take before the procedure, as long as you have somebody that's going to drive for you. But the conscious sedation is kind of a double protocol. We'll do Valium the night before and a Halcyon sort of an hour before the appointment. We crush it up, put it under their tongue. But we're monitoring them the whole time as well. We've got blood pressure cuff on them and a pulse oximeter, because these are respiratory depressants, and we got to make sure that they're okay. So we have the ability to reverse it if we need to right away as well. But that gets those people in the chair and calm, and it also has an amnesic effect. So after the fact, they barely even remember being there. So the whole process, they might still be shaking a little bit in the chair, but usually that's the challenging ones are the phobic ones.
And there's quite a few people that are afraid of going to the dentist. I mean,
Yes.
Adults or children?
All the way through. All the way
Really?
through. Yeah. I had one kid years ago. He didn't even get in the office. He was like laying on this concrete outside the office, having a tantrum. So I said, all right, well, send him off to a pediatric dentist who was able to manage that for him.
You know, the interesting thing about it is I've never really felt anything at the dentist, but sometimes it's the sound, it's the pressure. I can see how that would maybe create a phobia for some people.
Sure. The injections, some people are afraid of needles in general. They can't have blood work done. They struggle with that. So we try to really ease them through that. We're using some topical anesthetics. You can use buffered anesthetics, things that'll help really take the edge off and let them sit a little bit longer. You go really slowly as you do it. So we try to get that out, because that's usually the kind of the big fear is that.
Interesting, yeah.
How about technology? Is there any new technology that you're using in your office?
Yeah, we have a little bit of everything. Have multiple lasers, and with the lasers we can cut teeth or use it just on the gum tissue for soft tissue. So we do a lot of procedures with that. Have what's called E4D. It's a CAD/CAM machine, so we can do crowns same day. We mill it right there on the spot while you go have a cup of coffee and come back and we cement it so you don't have to get numb a second time.
Oh, so you're not shipping out, if somebody needs a crown, it's not taking a cast and then sending it out. You're
Very
doing it all.
rarely. When I'm doing a larger cosmetic case that we want the porcelain layered and different colors and hues put into it, then that's where you want it done on a lab bench by a technician that does that, only does that. But for 90% of what we do are going to be crowns in the back of the mouth that you might not even look at them that closely. I'm the only one who really ever sees it. But even with those, we can add color and staining to them. So most of what we do, unless it's a pure cosmetic case, is going to be done in-house.
Okay.
So yeah, it's great.
And that machine is pretty incredible. I've seen it. It's amazing.
Well, if you think about it, sometimes going to the dentist becomes a 6 month, you got to wait for this and wait for that. So it's nice to be able to get the most of the procedures done relatively quickly.
And especially with the crowns, if you don't have to come back and get numb a second time, you know, that's a huge benefit for it right there. Okay. So we've got that. We have a CT machine we do for implant planning and TMJ cases. Pretty much, you name it, we got it.
That's really fantastic.
You have that X-ray thing that goes around.
Right, it's a combination Panoramic XRay and CT machine. So the Panoramic is great to monitor kids when they are around 6 years old as the development is happening. It shows everything, but then the CT flips around, and that's for implant planning, because we need to know exactly the distance we've got to the nerve or to the sinus, how much space is between the teeth, because X-rays themselves can have up to a couple millimeters of variability based on how it was angled and it was put in the mouth.
Isn't that interesting?
Yeah, so it's cool. I wouldn't do an implant without it.
That's awesome.
Fantastic.
See that? That's great. So tell us about the community. What do you do in the community? I know you love to coach.
Yes.
And your son plays a ton of sports, right?
He's limited down in baseball and basketball. Actually does flag football also. So I had over the years coached for a long time in the Cal Ripken, town of Poughkeepsie, Cal Ripken boys team. Had a team plus the All-Star team, which at 10U and 12U, we won the Eastern New York State Championships and went to Mid-Atlantic Regionals, which was awesome. And then we did some travel with that team as well. CYO, I don't coach anymore, but that was great. Loved coaching. I had both my son and my daughter over the years.
Awesome.
My daughter actually used to play baseball as well. She was my top pitcher at one point in time. And for, she could do make a bad throw to first. She could do a full split and get it. There was nobody else in the league doing that.
She was the only one, I can guarantee that.
Yeah, correct. And everybody looked at me, oh, that looks like it would hurt. So other than that, I've been on various boards over the years. Right now, involved with the Hudson Valley Business Scholars Program at Marist College, which raises money for kids from the Hudson Valley, and all businesses do that. I chaired that for 6 years. I'm now just down on the board there. And involved and helped out with a lot of other things. The Grace Smith House is obviously a great cause.
Yes.
Great organization.
Yeah, they do great stuff, and so always try to contribute, help, donate to a lot of these.
You do so much. I see you all the time, all over. So thank you for everything you do.
And I think we're going to get a little brushing tip today, right?
So a proper technique.
Yeah, but I'd like to see a technique. I want to learn how to brush the right way.
Without using your water pick.
Yeah.
Exactly.
I like the water pick. You got to brush and use the water pick.
So essentially, you can hold the brush, and you don't want to hold it and grab it where you're power scrubbing it, all right? Soft toothbrush, the mechanical action is all you really need. We're going to go in small circular motions, kind of angled 45 degrees to the gum, so it's going, some of the bristles will slide under the gums that way. So you come around this way, and you do the same on the inside, and of course the biting surface, and reverse it all the way around. It should be about 30 seconds per quadrant of your mouth, so about 2 minutes total. The inside front ones, you kind of got to push the bristles this way, and if it were the lower teeth, you'd be doing sort of the same thing like that. So the key, small circular motions, take your time, cover all spots on there.
So adding force isn't doing anything?
Not so much, no.
I had no idea.
Yeah, the plaque that's on there is soft. It should come off. If it's not soft, then you're still not going to get it off. That's where your dentist is going to do it. Okay. And some people can build up plaque a whole lot easier, and plaque becomes calculus, and that's where it's hardened on your teeth, and that's what we need to get off.
And it's soft bristles, huh?
Yes, soft bristles. Soft. That's all you need. Once your teeth are clean, if you brush properly, do your flossing, do the water flossing as well, then you're not really going to build up the plaque. You got to just get the mechanical action of it. And the toothpaste is secondary. It's just the mechanical action is the most important thing to it. The toothpaste can provide fluoride and gives it sort of an abrasive to help remove some of the stuff a little bit more. But it's really the mechanical action of brushing that's important.
Interesting.
You bring up toothpaste, though. Now there's so many different types of toothpaste out there. I mean, does it really make a difference when you're choosing a toothpaste? There's whitening, not whitening,
Yeah, not in my opinion, no. It's that again, the mechanical action of brushing is the most important part of it. Some people have some issues with getting some sores from certain types of toothpaste, and that has to check whether it's got the sodium lauryl sulfate in it. So some people don't use that. They use like a Tom's of Maine. That's more of a natural type toothpaste. Whitening toothpastes tend to be slightly more abrasive. That's why they whiten. They might remove a little more surface stain if there's some for the coffee and tea drinkers of the world, the smokers. But just, again, the mechanical action, doing the brushing properly, have something that's providing fluoride, and that's going to do most of what you need.
2 to 3 times a day?
2 to 3 times. If you get 2, great, morning, after you eat, nighttime before you go to bed. If you're in a position or job where you can brush after lunch, then that's great also. If you can't, what we tell the kids at school is just drink water. Hit the water fountain when you're done. Try to help neutralize the acids of whatever you ate in there, or help remove any of the debris that's sort of stuck to the surfaces of your teeth, and that helps a ton as well.
Interesting. That's fantastic.
Well, there's all very interesting stuff. We appreciate you taking the time to come talk to us today.
My pleasure. I'm happy to do so.
One last question. Where can people find you online?
Dental Design Studio at Verizon.net is where I'm at. Facebook page, you can find just Dental Design Studio, the Hudson Valley.
And he's got an awesome website, too?
Yeah, we're rebuilding that right now. So
Awesome.
That's going to be redone. We got new photos of the team. We just got to pick out the photos and put it all together, new content. So it's very exciting.
Good stuff.
Thank you so much. Appreciate you joining us today.
Thank you.
We want to thank Dr. Whalen for joining us today. It was great to learn a little bit more about him personally and also his practice.
Yes, and about the brushing technique. I will definitely be trying it tonight.
Me too.
You can check us out next Monday on wakeuprhinebeck.com.
We'll see you then.
Bye.